Welcome, everyone. We're going to get started in just a minute or so. I see some people jumping on still. And welcome to our webinar on safeguarding childhood, the role of the North Dakota Child Sexual Abuse Prevention Task Force. Really excited for everyone to be here today. All right, we're going to get started. I know people are jumping on still, and that is okay. All right. My name is Mary Lizakowski, and I'm a Coalition Health Director with Foundation for a Healthy North Dakota, which is a nonprofit organization which was established in 2022 with a mission to promote health and wellness across North Dakota by working at the community level. We continue to expand our statewide coalition to foster collaboration among local communities on common initiatives. By becoming a member of the coalition, you'll be the first to receive information on educational webinar opportunities such as this, relevant public health information, legislative news, as well as access to digital advocacy resources and toolkits. Just a few housekeeping things to review. Webinar attendees will be automatically muted for the presentation. And after the presentation, a link to the recording will be sent out along with an evaluation survey to complete. If you have any questions, please put them in the chat box and we will address them after the presentation. It is my pleasure to introduce our presenter today, Lindsey Burkhardt. Lindsey has been leading the North Dakota Child Sexual Abuse Prevention Task Force since January 2022. In this role, she's been a driving force behind initiatives to keep children safe and well across North Dakota. Lindsey firmly believes that every child deserves a happy, healthy, and carefree childhood, free from the threat of sexual abuse. Outside of her professional life, Lindsey is a proud mom of 4 daughters. She actively volunteers with a nonprofit organization focused on boosting the self-esteem of adolescent girls and serves as an ordained minister, having officiated 3 weddings since 2021. Lindsey's positive attitude and relentless energy shine through in her advocacy work, making a significant impact in many lives. Her dedication hasn't gone unnoticed. She was honored with the Women of the Year Award in Youth Advocacy by the Fargo-Moorhead YWCA in April 2024, and the North Dakota Mother of the Year Award from American Mothers in 2025. Lindsey continues to use her voice to ensure children across North Dakota have healthy, safe, and thriving childhoods. So we are so excited to have you here, Lindsey, and I will turn it over to you to start your presentation.
Thank you, Mary. I was just thinking my bio says I have relentless energy, and I'm like, maybe I should change that. I have 4 little girls. I don't have a lot of energy, but all right, let me get my presentation up and we'll get started. All right, Mary, you just got to let me know that everything has transitioned over okay.
It looks great.
Perfect. Well, good afternoon. It's nice to see you all. Although I can't see you, I know you're here. As Mary mentioned, my name is Lindsey, and I'm extremely honored to be here with you this afternoon. As you'll notice, my presentation is bright and colorful, and that design choice is very intentional, symbolizing our collective effort to bring light to the issue of child sexual abuse, which has long persisted in silence and darkness. Today, we will discuss the North Dakota Child Sexual Abuse Prevention Task Force and our collective efforts to prevent child sexual abuse across the state of North Dakota, fostering hope for a brighter future where children everywhere can grow up safe and secure. And now let's jump into our agenda for the next 45 minutes. So this session will provide an overview of the vital work being done by the task force to protect children. This session will cover the task force's guiding pillars, statewide projects, and available resources designed to ensure the safety and well-being of our children. We'll also cover why it's crucial for us as adults to be educated about the issue. And lastly, what the future holds for the task force. Now a little bit more about me and why I do this work. Mary shared a great bio, so I won't say a whole lot. I'm from a small town called Great Bend, North Dakota. It's the very tip of southeastern North Dakota, kind of by the Wahpeton area. My background is in early childhood education. My professional career has truly been dedicated to helping others in some capacity or another. I'm a proud mama of 4 little girls. On the bottom right there, you can see them. An active volunteer with Bio Girls, which is, as Mary mentioned, an organization committed to raising the self-esteem of adolescent girls. And to me, as a mama of 4 girls, that's so incredibly important. And I'm an ordained minister, as Mary mentioned. In the top right is me marrying my sister and her husband, Seth. That was the first wedding I ever did. And I was so nervous. I was like, I'm going to cry the entire time, but I didn't, thankfully. And that's a little bit more about me, why I do this work. So I've been the task force director for the last 3 years, and I do this work not only to create a better tomorrow for the children across our state and for my sweet little girls, but I'm also motivated to do this work for the survivors in my life that I love so very much, and all survivors. There are an estimated 42 million adult survivors of child sexual abuse across the United States today. Although today we won't focus extensively on the issue itself, as our primary focus will be on the task force and available resources, I do want to mention this. Child sexual abuse is a tough topic, and some of the information I will share may be difficult to hear and potentially triggering, whether it affects you personally or not. So please take care of yourself. If you need to step away at any time, please do so. So we'll cover the history of the task force in the next slide and kind of where it came from. But first, I'd like to share a quick overview. So the task force, the purpose of the task force was to develop and implement a comprehensive statewide approach to the prevention of child sexual abuse. Currently, the task force consists of 20 amazing members representing a wide range of backgrounds and expertise. We have representation from the North Dakota legislature. We have two House members and 1 senator on the task force. We have representation from children's advocacy centers, the faith-based organizations, the Department of Instruction, Department of Health and Human Services, the BCI, and many, many more. On the bottom right, I decided to include the chair of the task force, Chris Johnson. His leadership has been instrumental in our progress, and he's personally been a great mentor to me along the way. Chris is a true champion for child sexual abuse prevention across the state, and I believe us as a task force in our state are so fortunate to have him serve as the chair of the task force. And all of the members on our task force are appointed. So this overview traces the history of the task force in alignment with legislative sessions starting back in 2017 and current to 2025. So we're going to start at the beginning. And I know sometimes this stuff can be not the most fun to hear about, but I think it's important just to talk about where we came from and what we've done. So the task force was responsible for gathering information in the very beginning. So Senate Bill 2342, that established the task force. And in the beginning, we were responsible for gathering information on child sexual abuse across North Dakota and developing recommendations for legislation to reduce such abuse. It was also required that the task force at that time submit a report to the legislative management outlining our findings and proposals. And from there, we did that. And we jumped to 2019 session, and House Bill 1237 reestablished the task force of the prevention of child sexual abuse through 2024. The task force was responsible for developing and implementing that comprehensive approach to preventing child sexual abuse. This bill, Bill 1237, ensured continued efforts in policy development, education, community engagement to address prevention. The task force worked on strategic planning throughout that time, legislative recommendations, and strengthening intervention processes for affected children and families. We're going to continue to move along to 2021. Senate Bill 2275 provided funding for a director position within the task force. The bill aimed to support the task force's ongoing efforts in policy development, education, intervention strategies. So the task force felt, I believe, that they needed someone to help push the efforts forward. And so they hired a director. The funding went to Prevent Child Abuse North Dakota from the Department of Health. Prevent Child Abuse North Dakota, now known as Families Flourish ND. That's kind of where I started, and I get to pick up, and I can talk a little bit more strongly about what's happened since. So next in 2023, Senate Bill 2257 extended the task force's work through June 30th, 2025, ensuring ongoing efforts to develop and implement a comprehensive statewide approach. And then now here we are in 2025, just a few short weeks away from the task force ending. We won't spend a lot of time on this slide. I questioned whether or not to keep it. However, I believe that understanding our history is crucial for appreciating our progress and recognizing the journey we've undertaken to reach where we are today. So since 2019, the task force has pursued 4 strategic goals rooted in primary, secondary, and tertiary prevention strategies, as you can see on screen. Each of those goals had an operating subcommittee. That was the intent. While these goals encompassed prosecution, offender treatment, mental health services for survivors, the task force determined that a focused primary prevention approach aligned more closely with the initial charge of the North Dakota legislature. And for us, we decided we needed to refine our approach. In June of 2023, the task force convened for a strategic planning session to relook at the direction of where we were and where we wanted to go. At this strategic planning meeting, I had the opportunity to present a proposal to revise our goals and return it to our original mission to develop and implement a comprehensive approach to preventing child sexual abuse. So this meant shifting from a broad prevention framework to an exclusive focus on primary prevention. Since I started in my role, I quickly became a member of the national coalition Prevent Together. Prevent Together has developed a national plan to prevent child sexual abuse and exploitation. And that plan is built around 6 pillars that provide a comprehensive framework for the primary prevention of child sexual abuse. While many existing systems address child sexual abuse after it occurs through victim services, investigation, legal action, the national plan prioritizes primary prevention, focusing on more of a proactive measure to stop abuse before it happens. And so at that strategic planning meeting, I introduced the national plan to the task force members. And after thoughtful discussions, we agreed to adapt the national plan pillars as the foundation for our prevention efforts in North Dakota moving forward. I'm so excited to share with you our 6 guiding pillars to prevent child sexual abuse in North Dakota. These pillars, along with their surrounding goals and objectives, are the result of deep thought, time, and careful consideration. They're modified from the national plan. At their core is a commitment to primary prevention, ensuring our approach is proactive and focused on stopping child sexual abuse before it happens. And I really, truly could not be more proud of them. You can learn more about the goals and explore them more in depth on our website, which I'll share with you at the very end. Each of our projects that we've worked on and our resources, our advocacy efforts align with these pillars, ensuring a unified and effective approach to prevention. And now, as we go through the next couple slides, you're going to see how the projects, the resources, how they fall under the pillars. One of the things I don't have in a slide coming up is our policy advocacy and legislation work. So the last 3 months, we had a policy advocacy and legislation subcommittee. And as you'll see, that's one of our first pillars. We had a group that met weekly over the legislative session, and we tracked bills, we testified, we watched what was happening at the legislative level. We also Another exciting thing that I don't have on a slide is the work we have done through collaboration and organizational policy and procedure. Currently, we're working with North Dakota courts on getting some of our resources to them to get to their parent investigators, which is helping with systemic change, getting those adults trained in child sexual abuse and prevention. Another thing that we're really excited about is our work in collaboration and organizational policy and procedure when we look at the work we've done with Growing Futures and getting into their Getting Started modules. We have a whole section on child sexual abuse prevention. So we're so excited about the work that we've been able to do. And prevention research, I do talk about in the next two slides, and I'm excited to share that with you, which also coincides with funding and growth as well. So this is kind of on to my favorite part and some of the things I'm most proud of and some of the things that you might find the most beneficial throughout our time together today. So I'd like to share a bit more about the pilot project that we conducted in Richland County in 2023. If you're not sure where Richland County is, that's okay. I have a map up there and a blue arrow pointing to it. If you remember me talking about Great Bend, I said it's in the bottom southeastern corner of this state. It's in Richland County as well, which is part of the reason I wanted to conduct our pilot in those communities. So we launched our project in March of 2023, and it was a multi-tiered prevention. We used multi-tiered prevention strategies, which meant that we were going to provide child education across Richland County. We were going to provide adult education across the county. We were going to utilize social media and a public awareness campaign and data analysis. So how this went is in the very beginning, along with the task force, I wrote a grant hoping we would get funding for the project. And we were awarded $130,000 to conduct the project, which was just amazing. Prior to launching the project, Richland County residents were asked to complete a survey before the project launched, focused on us learning more about the knowledge and beliefs of the individuals who resided in the county. In the initial survey, 25% of residents did not believe that child sexual abuse occurred in their county. Additional beliefs included that children were at fault for child sexual abuse, children were most often abused by strangers, and children often lie about being victims of sexual abuse. Part of our project was to combat these damaging beliefs. So the project purposefully aimed our public awareness messaging to acknowledge the harmful misconceptions that exist around child sexual abuse. What we know is that public awareness is most effective when paired with accessible and appropriate education and resources. So often we would share where the readers could find more information as we were trying to bust down the myths. And on the next screen, I'll share with you one of our ads that we posted in the paper. We also had a billboard across the county, and that was on one of the busiest highways. So that was really fun to see when that went up. It was like right when you drive into Wahpeton, if you're familiar. So what we learned is that the project data showed encouraging results. However, the final survey continued to highlight damaging beliefs, such as children are at fault for sexual abuse. Therefore, not only that response, but other responses we received as well demonstrated the need for child sexual abuse prevention work to continue. And that makes sense to us because we know that primary prevention, it doesn't just happen in a 1 year long pilot project, but we learned a lot. At the top, you'll see a survivor story. As well, below that is an ad we posted in the paper. And again, like I said, we had the billboard as well. So when we did the survey, we would put the myths and then the person would say, yep, this is true, or no, this is not. One of the common ones, and I still hear this in many sessions I complete, is that sexual abuse survivors almost always become abusers. And that is such a damaging belief and a damaging myth. So whenever I do public awareness events and speaking engagements, I really try to bust down those myths, and that negatively impacts survivors. And we just want to bust those myths around, or that we've heard. One of the things that I think was so exciting as the pilot project wrapped up, the funding ran out, we were kind of ending our time in the county. But I had the honor of being invited to Wahpeton Public Schools, and I was able to do an in-service day with them. And that happened after the pilot project had ended. And I remember feeling so proud of, like, we opened the door in the community with our pilot project, and now the work gets to continue. And that made me so happy. And we continue to work with not only Wahpeton, but other schools within the county as well, and educate adults as well. So here are our guides. We're going to start by talking about the resource guide, which is on your left. In April of 2022, the task force initiated an environmental scan regarding the processes and the perspectives of prevention of child sexual abuse for the state of North Dakota. And we surveyed public, private, tribal schools across the state. We surveyed Head Start programs, licensed childcare programs. We basically reached anyone that we could, youth serving organizations as well. And we found that 64% to 95%, depending on the age group of the child, individuals we surveyed responded that providing child sexual abuse education to children was very important. 93% of the respondents to our environmental scan survey indicated that providing child sexual abuse education to teachers and coaches, again, very important. 90% of the people who took our survey also said that providing child sexual abuse education to parents and caregivers was very important. So what we learned is that everyone felt like this education was important. And then we wanted to know if, like, you think it's important, we recognize that, but you're not doing it. So what's the greatest barrier to providing child sexual abuse prevention education to children, youth, adults in their community? And 60% of respondents had identified that they felt a lack of established curriculum was the greatest barrier. Respondents had also reported that another barrier was the social implications of providing the training due to the topic being uncomfortable and sensitive in nature. So from there, with all of the data that we collected, the task force, the primary prevention subcommittee, worked really, really hard on compiling resources for schools, Head Start programs, youth serving organizations, and we began to develop the educational component of the primary prevention strategy, which was showing schools and showing childcares what prevention education is out there, what's out there for adults, what's out there to use with children. And we break it down by how much it costs, if it's free, the age group it's aimed at. We tried to be very specific and share as much information as we could. And this guide has been revised annually. And so after we finished the resource guide, we recognized that there's a great need for a practical tool to help parents and caregivers understand child sexual abuse and ways to prevent it. What we know is that people who sexually abuse children are less likely to target families where caregivers are actively engaged and informed. One critical aspect covered in the guide is developing a safety network of trusted adults. Too often, we don't fully recognize the importance of this, not only in creating a secure environment for our children, but also in engaging with the adults and the youth who regularly are interacting with our children. So this resource is something I'm just incredibly proud of. If you haven't seen it, I really hope you take the time to look at it. Before my work with the task force, I was aware that child sexual abuse happened, but I didn't fully grasp the scope of the issue until I've been working within it the last 3 years. I certainly was not having the conversations necessary with my own children. And as a parent of 4 girls, like I said at the very beginning, ranging from 9 to 1, I understand now why these discussions are often avoided. Many caregivers believe that their child isn't at risk, or assume that they're too young to understand, or they're going to scare their child by talking about it. One of the things that I like to share is, the last 3 years, I've worked a lot on body safety rules with my girls. And the responsibility to protect children does not fall on my kids. It falls on us as adults to keep them safe. But, teaching our children the rules of the body empowers them. And when they know if they know from the first inappropriate touch how wrong, but that it's wrong, they're more likely to say something. There's a lot of survivors that I've had the privilege and honor of working with that have said, if I would have known from the first inappropriate touch that it was wrong, how different my life might have been. And some survivors have disclosed that, they didn't know what was happening to them was wrong until they were 12 or 13 years old. And there are people that believe that teaching our children the rules of the body, takes away their innocence, but I believe it helps protect it. One of the things that my girls have taught me along the way, I've learned a lot from my girls, and my daughter, Adeline, she kind of becomes the center of a lot of stories I share when I'm presenting and talking about it. So we talk a lot about privacy and how important privacy is and how her body deserves privacy, even from people like her sisters or mommy or daddy, but how she deserves privacy, especially when she's like going to the bathroom or if she's taking a bath, things like that, changing her clothes. So one day I had a phone call from the school, and of course I'm like, oh my gosh, who's sick? That's my first thought, of course. But it was my daughter's teacher. And first of all, if you have never heard me speak, don't be alarmed if I start crying. It's normal, even if it might throw you off. But I get emotional about the issue quite often. But anyway, my daughter's teacher called and she said, Adeline wanted me to call you. And I was like, what happened? And she said that when Adeline was going potty, her friend crawled underneath the stall where she was going potty. And Adeline got upset and she came to me and she said that I needed to call and let you know that her friend crawled under the stall and that she needed privacy. And I just remember, like, when my little girl got off the bus, my preschooler got off the bus, I remember how proud I was of her for acknowledging that she could go to a trusted adult, which we talk about, and tell her trusted adult anything, and they'll believe her. And that her trusted adult was asked to call me, and her trusted adult did that. And I remember just hugging my little girl when she got off the school bus, and I was so proud of her. And that's just a story that sticks with me because she knew that her body deserved privacy. And when privacy was violated, her friend had no ill intentions, just being a preschooler. But she knew how to respond. And I was so, so proud of her. So back to the caregiver guide. Regardless of hesitation, starting these conversations with our children is essential. And inside the caregiver guide, you'll find things like some of those myths we talked about, myths and facts of child sexual abuse, healthy growth and development, specifically around sexual development, strategies for keeping kids safe from sexual abuse. We talk through grooming, red flag behavior, staying safe online. And in the way back, we have just some awesome resources and handouts, which I'll show you in the next few slides. But by using this guide, I think we can equip ourselves with the knowledge and tools needed to protect children and create a safer future for them. So now we'll go to the next slide and I'll share this. So the next one is more specific to the resource guide. And remember, the resource guide is more aimed at schools, youth serving organizations, childcare providers, Head Start programs. And most of these are on our website or they're in the guide. If for some reason you have trouble tracking one down, you for sure can reach out to me and I will get that information to you. I'll just give you a moment to kind of look through those. Keeping kids safe from sexual abuse on the school bus was something that we don't often think about this, but this is a place where there's not often a lot of extra monitoring due to the driver focusing on the road and getting children home safely. I can tell you that I know that my children have been exposed to things on the school bus that we would not share or show them at home. So that was one of the things that kind of sparked this for us is, how are we ensuring, what policies are in place that we can be sure that our children are safe on the school bus? There are certain things that I don't want my child seeing. And of course, they're going to see them, their kids are going to come across them. But if we can create policies to safeguard our children, I sure think we should try to. The next one are resources from our caregiver guide. Uh, and I don't know if all of these are in the current caregiver guide. I love our conversation cards. We have a summer safety flyer that's front and back. Coloring page. We have a cross or a word search. I love word searches. Healthy sexual development. On the back of the word search, we break down what is consent, what's a surprise, why don't, like, no secrets, no means no, autonomy. And then the poster on the bottom left, the My Body Safety Rules, those are posters that I have hung on my daughter's walls in their bedrooms. And more so because it's a reminder for me. So if I'm helping Emma put on her pajamas, it would be a chance for me just to say, what are our body safety rules again? Or let's talk about those. And again, just talking to my girls like I would have any other conversation about safety, like wearing a bike helmet or crossing the street safely. We decide if these conversations are scary or not with how we approach them. But I talk to my girls about body safety just like I would any other form of safety. I see we have about 15 minutes left. I think I'm on track. I wanted to share one of my favorite pillars to work within is the education and awareness pillar. I find myself operating in this pillar a lot. I love to educate and I love to raise awareness of the issue. So I travel all across the state of North Dakota speaking to groups about the issue of child sexual abuse, prevention, healthy sexual development, and I tailor sessions for specific groups and needs. There's been more questions about, like, how do we keep kids safe online? So there's just a lot of sessions that I've been asked to do, and I try to do them as much as I can. These are a few photos from the last few weeks of Child Abuse Prevention Month. So I wanted to end with, or start to end, or wrap up our conversation on why this work is critical. I think we all can agree that one abused child is too many. Preventing child sexual abuse is essential because it safeguards the most vulnerable members of society, our children, from harm that can have lifelong consequences. Beyond the immediate physical and emotional trauma, abuse can lead to long-term mental health challenges, difficulties in relationships, economic impacts as survivors navigate their lives. Prevention also fosters safer communities where children can grow up and thrive without fear. It's about breaking cycles of harm and creating environments where every child has the opportunity to reach their full potential. So here are some statistics around child sexual abuse. 1 in 10 North Dakota children will be sexually abused by their 18th birthday. And even that might not, that might not give us the true scope of the issue, because what we know is that 33% of victims never tell anyone that they were sexually abused. 33% never tell anyone. That every time I say that, I just think about the heavy secret that must have been or must be to carry an entire lifetime. In one study of over 1,000 participants, they found that the average age of disclosure of child sexual abuse was 52 years old. What we know is that 90% of children are sexually abused by someone they know. You can break that statistic down even more. 60% are abused by people the family knows and trusts, and 30% are abused by family members. Children being sexually abused by older or more powerful children used to account for a staggering 40% of abuse, but a recent study from 2022 conducted by Dr. David Finkelhor suggested that now that has increased to 70%. So considering that, based on the research or the study, that 40 to 70% of child sexual abuse is perpetrated by older or more powerful children, it's crucial to take a moment to discuss the importance of increasing our understanding of sexual development in children. And I know I don't touch on this nearly enough in this session. But what I want to say is that many adults are never taught what to expect as children develop sexually, making it difficult for us to distinguish between healthy, concerning, or potentially abusive behaviors. So when I studied early childhood education, I learned all about social emotional development, physical development, language development, and much more. But children's sexual development was rarely, if ever, discussed. Yet, understanding healthy childhood sexual development plays a key role in preventing child sexual abuse. Well, again, we don't have time today to explore the complexities of healthy sexual development, concerning behaviors, and the reasons some children exhibit them. Although I do have some of that on screen, I want you to know this. The more we learn about these topics, even though they sometimes feel uncomfortable, the more equipped we are to protect children. We know that children depend on us to keep them safe. And again, understanding healthy sexual development allows us to recognize early behaviors that may be concerning or potentially abusive, allowing us the opportunity to intervene and protect children. If you do want more information on the topic, please feel free to reach out to me afterwards. Here are a few research-based facts when it comes to children and concerning sexual behaviors. What we know is that many children demonstrate sexual behaviors in peer settings, like at school or at their childcare. Children with cautionary or concerning sexual behaviors have not always been abused. Again, remember, that's a very damaging myth. Children with sexual behavior problems are not younger versions of adult sex offenders. Children with sexual behavior problems are first and foremost children. And the good news is that most children who receive treatment for sexual behaviors, those concerning sexual behaviors, do not continue the behavior into adolescence or adulthood. What we know is that recidivism rates are very low. I'm just going to let this be for a moment. Most child sexual abuse survivors experience psychosocial losses resulting from the abuse. These losses include loss of childhood, loss of innocence, loss of faith in God or a higher power, loss of family relationships, loss of self-esteem, loss of personal power, loss of self, and the loss of ability to feel joy in life. People who experience child sexual abuse tell us that it affects their entire life, and research backs them up. One survivor that I care for so deeply told me that it's like a dark cloud that's followed her around her entire life. But I don't want to leave it there. It's important that we take a second to acknowledge that child sexual abuse does not necessarily sentence a victim to an impaired life. I know many survivors, many people who have found healing and hope, who have maybe found treatment, and they go on to live their best lives. So as you know, when we were talking about the history, due to Senate Bill 2257, the task force will officially dissolve in June of this year. However, this change comes with an exciting opportunity. Rather than seeking an extension, the state of North Dakota will absorb the task force's work, ensuring its efforts continue just through a new vehicle moving forward. So that's good news. The work will continue. Child sexual abuse prevention will remain a priority for North Dakota, strengthening our commitment to protecting children. That's a beautiful picture on the right, isn't it? It was recently drawn for our organization by an incredible young girl who is a victim of child sexual abuse. I had the extreme privilege of supporting her mother through some of the darkest days of their lives. While I'm grateful that our paths crossed, I wish with all my heart that her daughter had never had to endure what she went through. What I want to say is that we need you in this fight to end child sexual abuse. The task force, myself, the state recognize that our work is far from finished. Let's review those statistics. 1 in 10 children will experience child sexual abuse by their 18th birthday. 90% of the time, the abuser is someone the child knows and trusts. There are an estimated 42 million adult survivors of child sexual abuse facing lifelong consequences. These statistics aren't just numbers, they're an urgent call to action. I invite you to share in my vision and the task force's vision of a world where every child grows up safe, loved, and protected. Children deserve to be happy, healthy, and safe. So before we close, I have a call to action for you today. I urge each of you to consider how you can help prevent child sexual abuse. You might start by simply discussing the issue with your friends and family. Maybe you'll visit the task force's website and get some resources. Or maybe you'll ask about prevention policies at your child's school, or maybe a summer camp they're going to attend. And if they don't have any, point them to our resource guide. You can invite me back to speak with different groups about this critical topic. Like I said, education and awareness is my absolute favorite. But think about it and what steps you can take today to help create a safer North Dakota for our children. For mandated reporters, we need to report suspected abuse. And if we don't, failing to report can result in legal consequences. So we need to report. We should want to report if we suspect abuse. Even for non-mandated reporters, we have a moral obligation to protect children. If you're not sure if you're a mandated reporter, you can go to the Department of Health and Human Services website and find the list of those who are mandated reporters by law. And again, failing to report can result in legal consequences, and also just thinking about the safety of our children. What about if any of you on here have ever had a child disclose and you're just like, I didn't know what to do, I froze. I know that can be so overwhelming in those moments. But if a child discloses abuse, we need to listen carefully to what they're saying. We need to be patient and focus on their words. We need to avoid expressing our own views or feelings. If we appear shocked or disbelieving, they might stop talking or retract their statement. We need to let them know that they've done the right thing by telling us. Reassurance can make a big impact. Knowing they've shared their secret can be a significant relief. We need to tell children it's not their fault. Abuse is never the fault of a child. It's crucial they hear that and they understand it. Couple don'ts. Don't confront the alleged abuser, and don't make promises you can't keep. Like, you're going to be safe now. You're never going to have to see so-and-so again. And then lastly, report the abuse promptly so the details are fresh in your mind and action can be taken quickly. It can be helpful to take notes immediately after speaking with a child, just to keep them as accurate as possible. What I want to close with is that this information is not intended to cause alarm or to cause panic, but to equip you and other adults with tools to protect and empower children. So that's everything I had for today, Mary. I finished with 1 minute.
Wow, great work. Oh, such wonderful information. And really thank you, Lindsey, for being on with us today. I'm just going to quick share my screen before we move into questions. And why can't I? It. Oh, there it is. Okay. All right. I don't see anything that has come in the chat, Lindsey, but we did have a couple comments and questions that came in during registration. And so we can move into that. I just want to note that there is an evaluation survey QR code that people can scan as we are going through questions. And so the first question is, and you did kind of talk about this, but a contact website for a list of resources available in each county. Is there anything broken down by county?
There is not. So I work for Families Flourish ND, and so that's a statewide nonprofit. So the information that we have and the resources we've developed are really aimed at all communities. But if you do have specific questions about, because some communities do have, maybe their children's advocacy center provides child sexual abuse prevention education or training, there are specific resources in each county that you are able to look into. Like if you do want education, um, I'm an option for now, but also this within your community. Some of the crisis centers also provide education as well. And then also I did put the website. Oh, Mary, you did too. So,
Yeah, because I think you sent it to just me. So
oh my gosh, I did. I'm
that's
so sorry.
no, that's okay. I caught it.
Yeah. And then the website is, I try my best to keep it updated. I do recognize that there are a couple things I need to get updated, but with the transition coming, I'm gonna do my best to get everything updated and ready to go, moved over to this date. So, but it's in progress. So if there is a resource that you're like, oh, Lindsay, I saw that, but I'm not finding it, just reach out to me. I have no problem sharing that.
Sure. And then there is a recording of this that will be sent out, and we will put links into all of the resources that Lindsay has shared, because that'll be important for everyone to just kind of get in a list. And we are not offering a certificate of attendance for uh this webinar today. Uh, and Lindsay did put her email in there as well. And we can also we'll include all of your information in the follow-up email. Let's see. We do have one more question. And um, I think it's kind of like if a person is in a clinic
Mhm.
or public health unit and
Mhm.
they're not sure if there is abuse, but they're suspecting it, but they're not sure that it's that kind of what
Yeah.
like what are the resources and what would you recommend in that case?
So my recommendation would be to report.
Okay.
They're making a good faith report. There's nothing wrong with making a report in good faith. If you believe like, yep, I think this is abuse, but I'm not sure, I would say to file the report. It's better in my view to be safe than not reporting. Um, Additionally, I do have some resources on like the signs and symptoms of child sexual abuse. What I will tell you is that emotional and behavioral signs are much more common than physical signs. So, tuning into some of those like regressive behaviors, maybe a child who stopped sucking their thumb started to suck their thumb again, a child who stopped wetting the bed started to wet their bed again, running away, self-harm, um, some things like that. I didn't cover that again today. We would have totally ran out of time, but there are some different resources available. So, just
Okay. Maybe we can send that out also with the
yeah,
follow-up.
yeah,
So we'll
yep.
have a bunch of things. Okay. So here's one. I recently heard that if a child knows the correct body part names, the offenders are less likely to assault a child because they have been educated. Have you heard of this, Lindsay?
Can you say that again? Sorry, Mary. I was
Sure. Yep. I recently heard if a child knows the correct body, like correct names for their body parts, the offenders are less likely to assault a child because they've been educated.
Yes. I talk about this a lot actually. So there was a study done with 91 convicted sex offenders, and almost every single one of them said that they would be less likely to target a child who knew their correct anatomical names. I just had a session last week with a childcare provider, like a center, and we were talking about this, and they're like, well, how do we call a penis, and how do we do this when we're working in childcare, and if the family doesn't? And I would say, if you're in that setting, I would put it in my policies that we use correct anatomical terms if we're helping diaper, if we're helping a child in a bathroom. Yes, sex offenders from this interview that was done said that they were less likely to target children who knew those correct anatomical names. And I can tell you, like, I mean, I have 4 daughters, so like having those conversations, like it at first it was like, oh my gosh, yeah, that, ooh, how do we do this? But I have a book I really like that has like anatomically correct pictures. It's a child's book. It's called It's Not the Stork. And that helps like having that conversation and can make it a little more comfortable. I remember one time when it was Christmas and I was talking to my sister-in-law and I was like, Adeline had, of course, Adeline had said something silly. Well, not silly. She said something to me and I just thought it like was funny how she said it. She goes, Mommy, sometimes my underwear gets stuck in my vulva. And I was like, oh, yeah, that happens, you know. And I was telling my sister-in-law about this, and my sister-in-law goes, oh, how does she know that word? And to me, that alone is like, that's so shocking. My daughter should know her correct anatomical body parts, like from her nose to her elbow to her vulva. Our children need to know their correct terms. And I used to do a training called Darkness to Light. I don't do it much anymore, but there was a story where a child, what they were doing a session on child sexual abuse prevention education or educating children, and the little girl like kept raising her hand and she said, my uncle ate my cookie. And like the teacher or the counselor, whoever was doing it, like just like took it like, okay, they made cookies, whatever. This child was trying to disclose abuse and they had no idea because this child did not have the correct anatomical terms, could not disclose. So it took a while until they were able to determine what the child was trying to say. So yes, as much as you can, teaching those anatomic, and even if you didn't start off that way, start. I would just recommend start.
Mhm. Thank you for that.
Yes.
Let's see. I don't see any more questions.
Here's a resource for anyone looking on more reporting information as well in the chat box. I love talking about prevention, and I could talk about it all day. Like the things that we can be doing, I could share, you know, those are conversations that I love having. Things that we can teach our children to empower them to say no should someone touch them in a way that is inappropriate. Those are conversations I love having because I think empowering children, educating adults, those are all ways to prevent child sexual abuse and safeguard and keep our children safe. And I'm just so happy the task force's work is going to continue. I think it really shows the value of how our just how much our state prioritizes our children and wanting to keep them safe from sexual abuse. So I'm glad that the work will continue. That didn't come out very smooth, but you know what I'm
Oh,
saying.
oh goodness, all good. All right. Well, I don't see any more questions unless it trickles in as I go to our closing. Um, let's see. Yeah. Okay. Well, I really want to thank you, Lindsay, again for being here and to all who could attend. This was just such a really wonderful webinar with such great education information on what is happening and the work that you're doing across the state. So thank you. And to stay connected with us, you can follow Healthy NODAC on Facebook, Instagram, Twitter, and Foundation for Healthy North Dakota on LinkedIn. Also, to join the coalition, you can visit the link to stay aware of future webinars and updates on the foundation. And then again, there's the QR code, another opportunity to take that before it's sent out via email. And thank you everyone for being here today. And I hope you have a great week.
Thank you. Bye, everyone.
Thank you. Bye.